Hi, everybody, and welcome back to session 3. Today, we're going to be talking about urology, and I'm going to introduce Sergeant Knoll and Sergeant Gibson, who are going to be today's presenters. Go ahead.
Hi, everyone. I'm Tech Sergeant Lauren Knoll. I've been in the military for 12 years now, and I'm currently stationed at Travis Air Force Base.
And as for me, I'm Staff Sergeant Daria Gibson. Originally, I came from Edmond. Been in the Air Force for around 6.5 years now. Just recently PCS'd here to Travis back in March of this year.
Right when everything kind of popped off. So we're urology techs, and we're going to kind of just talk about our job. So as far as the requirements for becoming a urology tech, my situation is a little different than his. So I brought him in to speak on that because I was a pipeliner. So I went straight through the same tech school that you guys did. And then I went on to Portsmouth for several months, and that's how I went in. So if you want to speak on the process of.
And like Sergeant Knoll said, our situations is very different. As for me, I actually shredded. Now, pretty much in layman's terms, shredding is going under pretty much the umbrella of your own career field into a more specific career field. So by nature, I was a surgical technician, and I shredded. In other words, I went more into a specific field of surgical technology, which is urology. And I ended up having to go to a school, which was for about 16 weeks. And within those 16 weeks, you had about 10 weeks of clinicals as well. And clinicals pretty much are the hands-on versus the academic portion of your studies.
So when you applied, did you log on and have to turn in paperwork, and how did that work?
So the entire application process, of course, you have to go by way of MIPERS. And on MIPERS, they have all of the detailed instructions step by step. Pretty much you have to get your surf data and pretty much anything related to your military career. You have to input all of that information and upload it into the MIPERS. So once you do that, you have to make sure, or you have to wait rather, that you're cleared to go and you're accepted into the program. Because believe it or not, there's a specific amount of slots, per classroom or per class date. So for me, I was the lucky one. I believe it was 2 slots available, and I was one. No one filled up the other slot. And afterwards, before you get sent off to school, you have to get accepted. No, you have to be cleared by the commander of your squadron. And the commander of the squadron is the one that actually releases you. Then you go off to school and pray to God that you can pass so you can start your new life.
Right. So I think there can sometimes be a disconnect between the shreds from what I've witnessed in urology versus, and I don't even want to say versus, but the surgical techs, they really don't know what we do. So we go to school. For me, again, I went to the same surgical tech school that everyone goes to. But in urology school, we learn more clinical, rooming patients. We learn how to talk to patients that aren't sedated. That's a big one. And we do procedures on our own under the supervision of a provider. So cath changes, there are injections that we're taught to do. We can do like radiological procedures. We did like VCUGs, like IVs. It's pretty, I think what I appreciate most is that I can see patients on my own and I get to know patients from presenting to the clinic with an issue, getting that diagnosis of an issue, getting treatment, and then, coming back, thanking us profusely for whether it be a lifestyle change or saving their life. So I think for people who enjoy getting to know patients and like a more social type work environment with new people every day, or people that you'll know for like 8 years, that's one big bonus to the clinic life.
And just to piggyback upon what Sergeant Knowles said, one of the things that I really fancy about working in the urology clinic is the familiarity with the patients. Now, what I mean by that, just to go more in depthly, is that it's nothing like having good bedside manners. Bedside manners are pretty much the way that you conduct yourself, your professionalism with the patients. If you're viewed as an individual that is very snobbish or very rude, you won't be welcomed, really. Of course, you can still do your job, but the patient isn't going to like you. While on the other hand, if you have very good bedside manners, you are able to put the patient at ease. One thing that I love to do is go into the room, put on some nice calming music, right? And the voice, of course, the voice helps with that. But it's nothing like having one of those patients that at the end of the day, thank you for what you have done. And if they have to go into the actual operating room and they look, because of course, they observe what's really all in this room. They've only heard rumors and stories and horror stories, rather, of what happens in the operating room. But when they see your face, then you can actually tune in and key into the noise, that's all of the noises that's over there on the anesthesia machine, the heart rates and things like that. And it starts to slow down. It starts to show you that now they're being calmed down and they're soothed.
Yeah, there have been many times where patients have specifically requested me. We build that relationship, and again, that's what I find so valuable working in a clinic is there are patients that I've known for 8 years. They've known me, before I was a mom, and they my second kid, and it's really great. It's more, for me, more immediately gratifying to be able to follow up with a patient and have them say, oh my gosh, thank you so much. Like, I spoke to you on the phone and you told me this simple thing, and it really helped. Thank you. And it's just like, I feel like we get that almost every single day working. So I do want to go into like a typical work day for us. We're working in a clinic, so we work clinic hours. Usually it's 7:30 to 4:30, but when we're in the OR, we work OR hours. And here, as far as call goes, there are going to be places where the OR covers call because, we might have 1, 2, 3 urology technicians, and pulling call can be a challenge for us because we can't, we have to be present for clinic where we're working with 2 doctors. We have our own schedule. So here, fortunately, we've been helped with pulling calls. So it's, like I said, clinic hours or OR hours on our OR days. Here we have about 1 OR day a week, but if there is time available and we need it, we will have a case added on during the day. Today, for example, we had several clinic procedures, several technician procedures, and then we had an add-on OR case, but we're done for the day, so we'll be able to be out of here by 4:30. But depending on how many doctors there are, one of our doctors is PCSing, I've seen usually it's a couple doctors at most bases.
Usually.
We'll have, one doctor seeing patients where we're just rooming them, taking vitals. we might do like a quick ultrasound, and then we'll have another doctor who has like a procedure every 30 minutes, every 45 minutes, every hour.
Yeah.
And then sprinkled in among all of that are our procedures, whether it be we take out a catheter, we put in a catheter, we do ultrasounds. So it can be, what's your thought from, you know, being an OR tech and moving to urology? Like, what was your thought when you were in the OR versus now that you're a urology tech? Like, how has that changed?
All right. So I was one of the individuals that got the opportunity to experience clinicals before I actually got the chance to become a urology technician on paper. So I used to work in the plastic surgery clinic at Eglin Air Force Base for a while. So for the most part, I got the chance to understand how the clinic's workflow is. So now translating that over to today's time, let's see, pretty much the work, it's still very complicated. Nothing is easy, honestly. You still pull long hours, at least they feel like it. Yes, at least they feel like it. But other than that, comparing the operating room to the urology clinic, it's more gratifying, like you were saying. It's really more gratifying because at the end of the day, you have, whether it's a 26-year-old gentleman or a 87-year-old lady, they have to pretty much humble themselves when they come to you, because urology, you know, we deal with the reproductive system and the parts that everyone tends to be ashamed of, you know, so it's very gratifying, honestly.
Yeah. I would say so. It's but it is busy. So that I feel like is something that I commonly heard, that we're just kind of sitting, waiting, trying to tee up surgeries for the OR, and that's really not the case. We have a lot of patients that are not going to be on an OR schedule anytime soon. I feel like that makes up like a good portion of our day.
So Sergeant No, I understand that you were a pipeline
Yes.
individual for the Air Force, and here you are. However, you have tasted a little bit of what the workflow is in the operating room. So despite you being a pipeline student, why did you really do urology?
So actually, that's kind of a good question. So when I went through medical tech school, I had two instructors, one of which who I believe either spent time in urology or was a urology tech. And she, I don't know what it was. I'm still to this day going to say it was a compliment, but she said that she thought that I had a better personality for clinic. And that she didn't think that I would enjoy, you know, just dealing with patients who were asleep all the time. And I think she was right. So I thank her for that, because I didn't know any better. I was 18 years old. I didn't know. She knew better. She knew me better than I knew myself at the time. So, like I said, that's one of the most gratifying parts of this job, is just getting to really truly know the patients. And another thing is getting to know doctors. Like, I've seen in the OR, like, some people get so excited when they're like, oh, I'm in, you know, this service today. I get to work with this doctor. And it's like, I work with the same two doctors all the time, and it's great. Like, they get to know me on a level that I just don't think is the same in the OR. Correct me if I'm wrong. But we get to spend years together for the most part. And so we build a relationship. I know exactly what they want. They know how I am. We learn to work well with each other. I have not had a doctor that I didn't thoroughly enjoy working with. So that's another big thing, is just always kind of like knowing what you're going to get into for the day. Like, you know, not just seeing where your name is placed on a board and it's like, you know, the day before, I know which doctors I'm going to work with after, spending so many years at a base. I know the patients that I'm going to be working with. It's just, I think it's a much more personable experience all around working in the clinic. So
the team dynamics are impeccable.
Oh, they have to be.
Yeah.
They have to be.
And the relationships that you tend to cultivate with the doctors themselves, of course, they're professional, but it's like we're one big family. We're one big family. But returning the question to me, the reason why I decided to choose urology out of a lot of other things is because it's very humorous, because everyone that knows me knows that Sergeant Gibson is not like blood. So then the next following question comes, how did you end up in a medical field, right? Got to ask the man above. So here I am. And the surgical realm, the strict surgical realm, was not truly appealing to me. I did it for the 6 years. I'm like, okay, if I plan on making this a career, or if I plan on getting out, how can I make my life the most enjoyable? Urology. It doesn't have that much blood except during certain procedures, So here I am.
I wouldn't recommend, if you don't like blood, because there are some there's some times where it can be very bloody.
Exactly.
So and then as far as, you get some experience, if you were to get out of the military. I had a friend who was in LVN that pretty much did the exact same thing that we do here. Just the experience from, like I said, being able to comfortably walk into a room and say, sir, I need you to get undressed. Here's a gown. I'll come back in shortly. That takes a lot for some people. And I think that that's valuable experience. Say whether you want to go to nursing school or PA school, I feel like you get a leg up on the competition, just to be able to comfortably navigate through a clinic and understand working on Genesis or Alta CHCS, knowing, the flow of things, like this patient's coming in for a chemo treatment. I need to call down to the pharmacy. I need to check the lab work. I need to do this. Those are all things that the nurse that works in our clinic does. We know how to do it. And, there are a lot of surgical techs or medical enlisted that I know that kind of, want to maybe nursing school or whatever. And I see that as a benefit for if I were to get out, having this experience. I think it would help greatly. So.
All right. So we've, of course, answered what we really like about the clinic. Are there any dislikes about the urology world, per se?
We got a question.
We do.
I think one of the things that I don't really like about working in the clinic is that there are so few of them. So my options for overseas are Alaska, England, and Germany. I can't go to Italy. I can't go to, I'm not even really aware of all the awesome bases. I try to just keep that out of my mind. And then, the major MTFs, that's pretty much the only places we can go. So that is unfortunate. And then also making rank can be a little more challenging because there are so few of us. And right now, I wish I remembered the numbers, but I feel like most of us are, I think we have one airman in the field. Most are staff and tech. So we all kind of bottleneck, if that's the correct term. And then, they might give out 1 or 2 stripes. So that's always been something. And I think the likelihood of being able to work outside of your job, if you wanted a little break for to work at the schoolhouse or like DSD. I've never been picked up for DSD. I've worked at bases that were undermanned, and so for someone who would be looking into those kinds of opportunities, that's something to think about. It might not happen depending on for a certain time, depending on where you're stationed and how the manning is in that clinic.
That's true. That's true.
Anything else that you would say you don't like?
Pretty much the same
Pretty much
thing.
hit the nail on the head. Yeah.
The locations and the options of the locations.
Yeah. We got a
You,
question.
you know what? So before we actually go to Q&A, we have one last question before we go to the actual Q&A of the viewers. So, outside of the military, what can we do with this experience? What can you do with this experience?
Well, that's what I touched on as far as like, future endeavors in like, whether it be PA or nursing school. We can always get our certifications just like you guys can to work on the outside. And if I were to know a doctor, like I've had doctors that I've worked with surgeons say, like, if you get out of the military, call me, I will hire you. And it's the same, it happens in the OR too. If they say, hey, if you ever get out of the military, I'm going to be here, call me. I would love to work with you. Exactly. It's the same thing. So it's just establishing those relationships. And then, that's.
And pretty much the same goes for me. However, you could also use the skills that you learn in terms of personal relations with individuals. You can pretty much use those skills as well. Yeah. So, all right. So Q&A time.
Yes.
All right. So the first question is from a young lady named.
I think it's Tech Sergeant Vickers. Do you guys suggest OR techs spending a few days shadowing the clinic before making the choice to shred? Absolutely.
Oh, yes.
Absolutely. I don't think I've ever had someone come and help us in the clinic and have the first day be like, oh, this is great. Like, you guys are just cool chilling. Like, they're just like, holy cow.
Right.
I didn't know this was what you guys do in the clinic. So absolutely, I would say, even if it's just for like a couple days, they don't even really need to see, maybe in the endo suite, like in the cysto suite, OR, but just clinic life. Just get them in there to see it before they make any decisions, for sure. And some people, like, if it were me, I would probably have loved it, because I do love the, not running around. I don't want to say running around, but yeah, it is fast paced. You're not sterile 24/7. You can itch your nose and talk to patients that are awake and alert. So yeah, I would. Some may not, and I think that they should know before they.
Because this decision is a big decision.
Yes.
Because whenever you go ahead to choose urology, you at least have to sign up for at least 4 years, 4 or 6. So that's a long time. You want to be sure that this is something that you would like to do. Okay.
Another question was, do we get a bonus? So 2 years ago, I think I got like a $58,000 bonus. I'm pretty sure they took that away for almost everyone. So my first time reenlisting, I've only reenlisted twice. My first time reenlisting, I got like a $10,000 bonus. My second time, I think it was like $58,000 that I actually got. I don't remember what the number was. So that was nice, but I think that they just did away with.
Bonuses are over. No more.
Yes. So there are different ways that the bonuses work. So my first was $10,000. I got, I believe it was half up front, and then the rest over the term of my enlistment. Then the time I got the 58,000, I think it was half up front and then the next half the next year, I want to say. They have different ways, and there are, in the information that they send out with the bonuses and the shreds and stuff, it will tell you like what zone you're in and how you can calculate what you'll get and how it'll be dispersed.
And with my own situation, I will say that it's better to just go ahead and contact your local finance department. They will go ahead and simplify it all for you.
Another question, can you do any other jobs in the military once you have shredded? So it's dependent on where you're stationed. If you are sitting fat and pretty and you have, a lot of civilian support, you may be able to go, depending on what kind of job, like you can go work in infection control, or you can go be like, but as far as DSD or anything like that, I haven't seen anyone get picked up for anything like that in our career field. Obviously the schoolhouse, you can be an instructor, but I think that's the extent of working outside, because there's so few of us.
Like
so,
when Shannon, you're locked down. Pretty much.
You make it sound so bad.
In a good way, though.
Yes.
For a good
yes,
cause.
Absolutely.
Can you ever drop your shred code?
As far as I know, not now. No.
Right.
No. That, I guess, is something that's being discussed as, with the shift in the foreign situation. But no, not right now.
Let's see. Any other questions?
We're just looking to see if there's any
questions at all. Does urology have a book for WAPs to study? To my knowledge,
we
yes.
have like the nursing, like Mosby's nursing, urology nursing, stuff like that. And then we have like our CDCs.
Exactly.
So.
Exactly.
And do you deploy as a urology tech? As far as I know, the last time that a urology tech deployed as a urology tech was like 2009. And that would have been me had there not been other situations going down. But I think after that, the Army took over or
Pretty
Germany,
much.
something happened. So no. We're not deploying as urology techs right now. I don't know anyone who's deployed.
If anything, you may deploy as a slick or standard surgical technician, but in terms of deploying as a urology technician, because of how minimally staffed we are, no, not at all. Not at all. Well,
I think that's it.
I think that's so.
How do you keep up with the other surgeries for deployments? Okay, so I feel very strongly about this topic because there have been technicians that are in the open OR that had to be shown like a book Walter, and I have come from a base where we were doing open prostatectomies, like open nephrectomies, like big open cases. So we do, cases that require a buccal graft and book Walter and, all of these intense instruments. Like sometimes I would argue that we have some of the coolest cases as far as like anatomy goes, seeing inside these days. But we also have our CMRP hours that we have to do. So we work really hard to try to get into the OR, and whether it be switching off, like I've done this, like switched off with ENT, gone into a general surgery case, but we have to really make the effort because, again, you know, if we're not in the OR scrubbing our own cases, we're busy in the clinic. So we'll usually have to work with people to get that extra time to spend in a case that is not urology. Are there special CMRPs? So we do have to like sign off on all the same, like we'll have on our training days, we'll go down to the OR and we'll get the same training. At least I can speak for my last base. We would go and get the same training in SPD. When I PCS there, I spent time in SPD. When I got to my first base, I spent time in SPD. But that's more of like we'll get sent down there when we're training.
Pretty much.
Yeah.
That actually answered the next question. Do you spend time in SPD?
Yeah, that's what yeah. If you're at a smaller base or even larger, are you able to scrub at civilian hospitals? So sometimes yes. I don't think we do that here, but I believe that they are trying to make that work right now because we do not have a robot, and there is a robot off base that we may be able to scrub so that we can do robot cases, because a lot of the residents now are trained on the robot. They want to keep up that skill set, and when we don't have one here, they're going to work hard to get some sort of sharing agreement so that they can go. So that's usually the situation that I've seen. I believe Andrews worked at another base where they would, and I think it was because of the robot situation. Exactly. So yeah.
There's specialized annual urology training that slicks don't have.
I hope not.
Right.
Because if that's the case, I wouldn't. There's no annual.
Not that we know of. Not that we know of.
Do you guys train SPD on your IFUs for your scopes? So, this question. At my last base, as we didn't use the Steris, we had all of our scopes blue wrapped, and they were put in the Sterad. And just coming here and using the Steris again, the techs here are great. When we have a certain amount of scopes that we blue wrap and we send down, and that works well. But as far as I know, they are not familiar with our Steris section. That's not to say that they, right. Some places I believe still have the Steris, but I think they're doing away with that.
It almost varies per base because, for example, at Eglin, some of the technicians, before there was a transition with the newer equipment, some of the technicians actually knew how to operate a Steris machine. While coming here, they don't. So it just, I guess, varies per location.
Yeah.
Per location. Yeah.
Okay. I think that's all the questions that we're receiving. So I thank you guys for listening to us talk for probably way longer than we thought about. I just love urology so much. It's all I know. And, you're new to the game,
New
but
to the game.
yeah, we're working through it together.
We
So
are.
anyway, thank you guys.
All right. Thank you, Sergeant Knoll and Sergeant Gibson. I appreciate it. So I want everybody to realize that this week we're having 3 sessions. So today was urology. Tomorrow we're going to hit up ortho, and then on Thursday, ENT. So y'all learn about all the shreds individually. So please tune in. The login will be exactly the same as it was for this session and the previous sessions, along with the password. If you do not have that, feel free to message me and I'm happy to get it to you. Also, they will all be at 1700 Central Time. So I hope that you tune in, and that'll wrap up this session. Thanks for joining us.